My very basic and the very first question for you is like at what point of your time did you make a decision that you want to pursue your career in MBBS?
Yeah, this is a tricky question actually. So throughout my childhood, I wanted to study Tamil literature, but the dream of middle class families is making their child as doctor. So my parents, they wanted me to become doctor. So actually, they tried with my elder sister. So for my elder sister, they tried actually in Russia only. So at that time, I don't think this much uh, uh, good institutes like like Moksh and all was not there. So at that time, they could not find correct people to connect through. So my sister could not achieve her dream. But now she is staff nurse. She is happy. So for that, then they thought, okay, let's make our younger child as a doctor. So anyway, so I joined this. I because of my parents. To be honest, okay, I don't want to lie. So because of my parents, but that after that I started enjoying my MBBS. Yeah, yeah. So that's what at that time, yeah, this institutes like MOOCs were not that much in southern part of our country. So my sister could not achieve her dream. So my parents, they thought, okay, they'll make their younger child as a doctor because I'm the last child in my family. So to fulfill their dream, so I started preparation for MBBS. So I dropped 1 year. So I dropped an year, then I joined this. But still, I read my that's what I read my Tamil literature whenever I get time. So MBBS didn't stop me from studying Tamil literature. Did you hear that?
Okay.
Hello.
Yeah, yes, we could hear it. So definitely it was,
Yeah.
a very interesting journey. So my students definitely would want to hear about your story.
Yeah.
Yeah, sure. Why did you choose biochemistry as your specialization?
So the thing is, that's what I was telling, three things, right? So whenever you choose something, you have to consider three things. So the thing which you are good at, the thing which you like, okay, because many things we like, people may like radio diagnosis, but they may not be good at that particular subject. And ultimately, it should suit your interest, it should suit your personal life. So these are the three things. So then I considered what I am good at. So those are the three subjects in which I got distinction, and one subject gold medal, that is medicine. That means somehow I am good at, right? So examiners have they have decided that okay, I am good at that subject. But that the thing is, I like my first year biochemistry very much. It is because of the teacher. There is something called halo effect, right? So because of the teacher, see, my professor, she was so good in teaching also, as a person also. She is very nice that she supported everyone. She used to conduct extra classes. The integrity, she taught us the integrity of a human being more than a subject. She taught us so many good things. So because of her also, and in my plus one plus two, I had a chemistry teacher also. She taught organic chemistry in a very good manner. So guys, organic chemistry is the one which is the basic for your biochemistry. Those guys who like organic chemistry, right, you will find biochemistry very very easy. So because of all these things, then I decided, okay, I'll go for biochemistry, not medicine, due to my personal reasons. So I had my own reason. I thought, okay, now I need time to study equally Tamil literature also. I told you, right? So my another important interest is the Tamil literature. So I need time to study that also. Then I thought, okay, I'll go for biochemistry. So that is why I chose biochemistry. That's why I chose the number one college. So if you are going to study biochemistry, then you have to study at the number one college, that is the Maulana Azad Medical College. So I chose that college to study. Yes, that is the answer.
Definitely, sir. I totally agree to your point that the three tips you gave that were very important. So, sir, my next question is like, how do you manage your daily routine? Like with your work life, your roles and responsibilities as a specialist. How does your day starts and how does your day ends? What are the working hours and etc.
Okay, so it depends at which level of biochemistry career you are. For example, during my post graduation, during my MD time, So that time it used to be a bit like more hard work is needed during my PG time. So you have to wake up early. So you go to the lab. So see, I will tell you what is this biochemistry PG. What we are dealing with. So then only you will be able to understand. So in the Department of Biochemistry, we provide three things. Okay, one is patient care. So for patient care, we provide laboratory results like blood glucose estimation, urea, creatinine. So all these estimation, right? So that comes under patient care, and many other things we do. Okay. Second thing is teaching. So third is research. So in any subject, actually this applies to any subject. So in any subject, there are three aspects. One is patient care, then is the medical education, that is you teach undergraduate and postgraduate student, and third is the research you do. So in any particular day, we will be involved in all these three aspects. So that is how initially we go to lab. In the lab, we sign all the results. We check whether all the results are correct or not. Then there will be undergraduate classes. So MBBS classes we'll be taking. Then as a research part, we will be doing thesis and all. See, currently now at AIMS it is research is more. Okay. So in Maulana Azad Medical College, it is the patient care and teaching which is more. So here at AIMS, it is research, then it is the undergraduate teaching. So you will be pretty much involved in like everything. So like you will be the full in charge for conducting exams and all. So once you are becoming like postgraduate, and after postgraduate there's something called senior residency. So after completing in Maulana Azad Medical College, I came to All India Institute of Medical Sciences, New Delhi as a senior resident. So I completed that 3 years ago itself. So before 3 years itself, I completed that. So that is for 3 years. So in that time, I was involved in teaching MBBS students, MD students, MSc students, so even nursing students. So for nursing students also we take biochemistry classes. Then I started doing my PhD also. So currently I am writing my PhD thesis. I almost completed. So just December I will submit my PhD thesis. So currently my main role is in the research. So yeah, this is more like that, and it will differ. It will differ based on institute to institute. So it is not fixed for anyone. It's like based on institute, it's different, and it's like pretty cool life, that I can assure you. See, now like you have seen, right? So internet is not there, so I just hurried to my institute. So what you are seeing is my room. So this is my room. So I can hurry to my AIMS room. So the life is pretty much chill, cool.
Okay, so sir, my another question from you would be like you choose your career in this field. So, if a student chooses this as their specialization, so what are the career fields they'll get?
Yeah, there are see, the possibilities are like innumerous. It's like either you can go and become a lab specialist. It's up to you what specialty. So in the biochemistry itself, there will be lab specialists who will be like involved in the laboratory management. So you can go for that. Then you can go for doing PhD and research. So you can become a researcher. So people who want to do cancer research, molecular genetic research, right? So all these things, biochemistry is the base. So but through biochemistry, you can easily become molecular biologist. So that research aspect you can do. Otherwise, you can just join as a faculty in medical college. So in medical college faculty, right? So these days there are a lot of opportunities. You won't even believe me. We are not getting people for biochemistry now currently as a faculty. We have that many vacancies open. Every other state there is AIMS opening, right? So we have now AIMS in pretty much every state. In state like UP and all, we have two AIMS. So we have lot of job opening for that. Initially, people used to say that if you take biochemistry, anatomy, physiology, and all, there is no job opportunities and all. That is utter lie. You have lot of job opportunities, and that's what I'm saying. The opportunities are enormous. See, now I'm planning to go and pursue my further study. Even after PhD, now I'm planning to pursue my further study. I'm trying. Initially, I tried for Harvard, but Harvard it needed like 1.5 crore for that fees. So that's why I'm now planning for Oxford. There is a course called Masters in Medical Education. So I want to learn medical education, so that I will be pursuing in that. So that's what you can shape your career the way you want. So there is something called bioinformatician, right? Bioinformatics is like, see, you take your DNA and sequence the entire DNA and compare that DNA with some other DNA, and also that is bioinformatics branch, DNA sequencing, RNA sequencing and all. So people can choose that branch. In our lab, I will tell you that we have sequenced Indian peacock. So from the India, we are the second lab to do that. So the genome of the Indian peacock has been sequenced very well for the first time by our lab. In the initially, they have also done the sequencing some other lab, but our lab sequencing is better, and we have published in a very good journal, authentic journal also. So that's what I'm saying, that you can go in whatever field. So even in biochemistry is a specialty, but under biochemistry also there are so many sub specialties. You can go to laboratory, so you can become laboratory expert, you can become a researcher, you can become a medical education expert. So there are so many options. Yes.
Okay, so students, you have your options available for you if you choose biochemistry as your specialization. So, sir, I would like to know: are you in the practice of treating patients, or you're just in the research field?
Yeah, currently I'm not in the directly involved in patients, treating patients. So for example, my thesis is on acute myeloid leukemia. So acute myeloid leukemia is a blood cancer. So in layman's term, it is blood cancer, hematological malignancy. So I'm working on that, I'm doing research on that. So this research in future it will help in the treatment of patient, but currently it's not directly going to do anything with the treatment.
Okay. So, sir, if you can share your one of the any experience while doing research, or if you had a case, if you handled a case with the research, including the research, if you handle the case, if every patient is a memorable one, every research is a
Yeah,
memorable one,
yeah.
so you can
So
share with us.
yeah, I'll tell you my internship period. So internship period is the most memorable period for me. So I will tell you. uh, I think most of you will be able to understand the clinical scenario. I think I can even ask you questions. Hmm. Students, be ready for the questions then. Okay, one fine morning, so I was just having breakfast in my mess. So then the staff nurse called. That was my admission day. So she called, doctor, there is a patient with quadriplegia. Quadriplegia means the patient is not able to move all the four limbs. Okay, you are understanding, right? So all four limbs, the patient cannot move. So the staff nurse told me there is a quadriplegia case. Then I reached there and I took the history of the patient. So then I found that the patient is a recently diagnosed diabetic. So the patient is recently diagnosed diabetic. You know, right? Diabetes mellitus. So for this condition, they give drugs. It's called oral hypoglycemic agent. So these drugs, they reduce the blood glucose level. Okay, so what I did is I immediately checked the level of blood glucose. So check the level of blood glucose, then we found that the patient is having hypoglycemia. So this is like most commonly encountered scenario. Patients, diabetic patients, they take drug and they skip the meals. So they don't take meals. Mostly the uneducated people, you know, we still have people who are not educated, right? So those people, they don't follow the advice. So they take the drug, the blood glucose level go low, and they end up with like coma. So that's what quadriplegia, because of hypoglycemia. Our brain is the first to get affected because brain requires glucose. Okay, so brain requires glucose always. Okay, always brain requires glucose. So when glucose is not there, the patient gets the neurological symptoms. So once we gave the blood glucose through uh, IV, there was a dramatic response. You won't even believe me. The patients were like, they were like, okay, it's a miracle for them, it is a miracle. you that I cannot even describe in the words. They got overwhelmed. The patients and their relatives, they were so happy. They were so happy. So I still remember that day, that just making a correct diagnosis and correct treatment, that can bring a change in life. So also I had many other patients also, like one patient we were suspecting inborn error of metabolism. So for that patient I used to carry the test to some other private hospitals and all. So patients, they used to be in contact with me even after years. So that's what the medical profession, right? It is so satisfying. You get satisfaction after the job. I don't know about other profession also. See, like today, the interviewer, see, after this session, see, I think she must be also getting that job satisfaction, right? So everyone is getting job satisfaction. I agree that. But in that medical field, I think you get that more compared to other field. So once you do your job correctly, you get that much satisfaction. So this is regarding the patient care. Regarding the education, so one, I recently, then it was that time, then I just joined AIMS. So there was a student who failed multiple times. So I was like personally teaching that student, and he passed that exam. After that, that was his last attempt in AIMS New Delhi. There is only 3 attempts. Okay, so after 3 attempts, if you don't pass, you will be expelled from the MBBS course. So at that time, it was a challenge for me. So I was teaching that student personally, and he passed. And then he told that I never realized that biochemistry could be this interesting. So that is like equal to any award. So whatever award I may get in future, that won't be equal to that student telling me. The student who failed 3 times consecutively, that student, he told me that I never realized biochemistry could be fun. So there are many instances like this. I think this much is enough for today. Otherwise, if you allow me, I will keep on talking. Yeah, Pooja.
So definitely, as I told you that every case is memorable. So I understand that there is no stoppage to sharing
Hmm.
our experiences. So thank you so much, sir, for sharing such a wonderful experience. And I guess that was the moment where you realized that you need to pursue your career in biochemistry, right?
Yes, yes.
Yeah. So, sir, my next question for you would be like, how is your work-life balance? How do you manage your, work life and your personal life together? Like,
Yeah,
how do you manage your
yeah.
weekends and weekdays with your work?
Okay. So to be honest, I don't get any holidays. Okay, uh, in no holiday at all, because I have chosen myself to work more. So in Saturday, Sunday also I'll be taking classes. I'll be doing something. So I have so many assignments. So I see, when I was writing my book. So far I have written 3 books. Okay. So in the third book is like that, biochemistry for undergraduate. So in that writing book, it won't allow you to stop. So it is like a mother who is pregnant. So only after the delivery of the baby, there will be some relief. So till then, you have conceived. So there is an idea you conceived that you have to deliver. So that is why I don't have any holidays. Otherwise, if you don't have any extra work, if you don't have any extra assignment, biochemistry is a cool branch. See, today also I went to gym. So every day I go to gym. I go to swimming pool. Now in winter they close the swimming pool. So in Maulana Azad Medical College there is a swimming pool. AIMS New Delhi, we have a very good swimming pool. So actually I still remember, I came for interview. I went and saw the swimming pool. Then I decided that I am joining here. Okay, I got the form also. Even though I didn't get the appointment letter, even though the result didn't come, I got the form for swimming pool. So the life is very chill here, chilled out life. So the institute is student friendly, institute like AIMS. So I before Corona, I used to go to trek. So I like mountains, especially Himalayas. So once in every 4 months or 5 months, we used to go to many treks. The last trek I went is Chhattisgarh jungle. So in the jungles of the Chhattisgarh, we went for a trek. So that's my last trek. So now after my PhD, I will start my life. So the work-life balance is pretty much cool. So I will say that it's not hectic at all. So initially I used to have night duties and all during my post graduation. At AIMS we don't have any night duty and all. It's like morning 10 to 5. So that is the official work. Official work hour is 10 to 5. But I take all the assignments. See, now also I am with you guys, right? So but this is giving me happiness. So I'm happy to share with you guys. So that is why I'm here. So that's the thing. So I'm pretty much happy with this
Yeah.
particular specialty.
Okay. So thank you so much, sir, for sharing your how do you, balance your work life and your personal life as well. So, sir, my next question would be, these students have just appeared for the NEET exam, and they would be completing their MBBS in the next 5 years. So, what do
Okay,
you think? How is your specialty a prospect in India or in abroad?
right. So I think most of you guys will be coming back to India. I think most of you, right? I think at least 80 percentage of you, and 20 percentage of you, you may decide go there, right? I think that is the thing. So in India, that's what last time I was telling you, right? In the previous question also I was telling, right? We have numerous job opportunities. So and the salary wise also it's like equal. See, whether you study medicine or radio diagnosis or anatomy, physiology, biochemistry for a faculty, the salary is going to be same. Salary is exactly same. For example, for assistant professor in Central Institute, you get more than 2 lakhs. The salary is more than 2 lakhs in Central Institute for assistant professor. Okay, so it's a well paying job and it's a rewarding job. Okay, consider about abroad. So in abroad it is most research opportunities are there. So if you do biochemistry in abroad, it is like research. In UK there is a separate branch called chemical pathology or clinical chemistry. So that is in UK, that is the branch there. So they don't have proper MD biochemistry in UK or in US and all. So in India only we have this MD biochemistry, India and Indian subcontinent. So in many other countries there is no MD biochemistry. There non-medical people they teach biochemistry. So the most scope is in India. So I should be honest in telling you that the most of the scope is there in India. Abroad, as a researcher, you may go and join.
Okay, so I guess students, you have more of the specialization, prospects in India than also in abroad. So thank you so much, sir, for sharing this thing. So, sir, I would like to know that you are particular in the research now. So, what are the new fields of research happening in your specialty? If I say, if we include after COVID phase and before COVID phase.
Yeah, yes. So even we also published pretty much few articles in good journals regarding COVID. So that we did on bioinformatics. So last time I told you, right? Bioinformatics is like you do the DNA, RNA analysis, that sequence analysis. So this COVID, it opened lot of research opportunities in biochemistry and other fields also, like microbiology. In many other fields, the research is going. So now, see, initially our country in India, the diseases were like infectious diseases. So people used to die of mainly infections like cholera. There used to be smallpox. Guys, you remember, right? There used to be a disease called smallpox, which is now completely eradicated all over the world. Now polio is also on the verge of eradication. So there used to be infectious diseases those days. Now the diseases which are now prevalent is they are non-communicable diseases like diabetes, hypertension, cancer biology. Why? Because the longevity of the person is increasing day by day because of the economic growth. See, our country is growing economically.
So once the country grows economically, the lifespan, the expected lifespan of the person is also increasing. So cancer is a disease that has the chance when you become aged. So there is no chance, no way to prevent cancer. So there is a textbook called Robbins Pathology. There it is written that the only way to avoid cancer is not to be born. Okay, the only way to avoid cancer is not to be born. So if you are born as a human being, there is a chance that you get cancer. Okay, so it is like that. So there is a probability. So with the advanced age, the probability of cancer is increasing. So now there is an ongoing research on cancer everywhere. So the cancer biology field, that is on the uprise. Okay, so that is one. And in the cancer itself, there is something called cancer metabolomics, cancer immunotherapy. So, and have you guys heard there is something called epigenetics? You might have heard something called genetics, right? So now we have epigenetics also. So epigenetics means it is the change in the gene expression without change in the nucleotide sequence. So there is no change in the nucleotide sequence, but the gene expression is altered. All these things we will study. So these are all like some emerging fields like cancer biology, epigenetics, metabolomics, and personalized medicine. So this is one thing I should tell you. There used to be a child called Mila. So she's a girl child. So she was suffering from a very rare disease. So the scientists, they have taken her uh, blood cells and they have analyzed her genome. They found out that particular kind of mutation, and they designed a drug that is specific for her. So the girl Mila. So the drug is called Milasen, Milasen. You can Google and you will find Milasen, Milasen. But unfortunately, I think a few months ago, I think that girl expired. But the attempt was made. So she was given a drug. So these days we can analyze your genome and find out what are all the diseases you are predisposed to in your future life. So this is possible. So this is possible. Currently it is available in countries like US. There are many companies, they are doing. So they will take your what they will say is they will give you a this thing. They'll give you a bottle of salt water. All you have to do is just goggle that water and send that water to the company. So in that there will be buccal cells and all. So that will be there. Once you do that gargling, right, the buccal cells will be there. From that cells they will isolate DNA and they will tell you you have this many percentage chance of getting diabetes mellitus in your future life. This you have this many percentage chance of getting so and so disease. I don't want to frighten you that I don't want any of you. Okay, for the matter of fact, I don't want any of you to get any disease. Okay, I wish all of you a healthy life. But this is all possible. Prevention is better than cure, right? So these are all the emerging things. So new things. It's can you imagine before? Can anyone could have imagined before some 50 years or 60 years that this is all possible? Just by studying your DNA today, we can predict the possible diseases in the later life. And also the I told you, personalized medicine. So initially drug is there, drug is made for everyone. Now just for one person drugs can be made. And another emerging field is stem cells. you know uh, if for a person some organ is affected, so stem cell research is going on in a very good manner, that that organ can be made possible. So the organ can be generated. But as of now it is still on work. Okay, it's still on work, but it is all on the emerging things. So there are so many things. I think we will discuss that whenever I take you classes and all, right? So when I take classes I will elaborate more. Yes, Pooja.
Okay, so thank you so much for sharing such a informative thing. So my next question for you is, Like, why do you think young doctors should pick your specialty?
Right. So, see, biochemistry is the chemical basis of human life. Whether you are aware or not, there are the chemical processes which are going on every one of your body. Okay. So, I think that, okay, if making aware of that, so learning what are all the chemical changes will be something which is good, and that will help the patient. So ultimately, so if these chemical reactions, when there is some abnormalities in the chemical reaction, that lead to diseases. So I think so. Learning this will help us to treat patients better. Okay, so I'm not telling you that you must take biochemistry. That's what. If you are a person who is like a researcher, then go for biochemistry. Otherwise, you want pure clinical, you want pure patient care, go for clinical subject. See, guys, once you do your MBBS, then you will come to know. There will be people, I still remember on the first day of dissection of the human cadaver, there will be people who fainted. Okay, in operation theater, there will be people who on seeing the blood, I know people who fainted. So humans, we come in various size and shapes, right? There will be introverts, there will be extroverts, there will be ambiverts. So we are like different people. Okay, if everyone is taking biochemistry, then there won't be any space also. So that thing I am saying is that if you are interested, you will find out during your course of MBBS, you will find out that whether you like or don't like. Okay, so that is it.
Okay, so definitely, it was a very true answer that students, if you are interested in any of the field, then you will definitely love it. So, sir, my next question would be, what are the subjects important as definitely it is a subject, but still, what are the subjects related to this field and important in MBBS curriculum to become specialists in your field?
Yeah, so that's the thing. So this is like biochemistry, right? So if you just study your first year biochemistry well, and medicine, see, ultimately what we are going to do, we are going to learn biochemistry, the chemical reactions. Why are we studying that? So that we apply that knowledge in the patient management. That is the whole basis of studying biochemistry. Okay, that's the difference between biochemistry, pure biochemistry, and medical biochemistry. What you will be taught is medical biochemistry. There are non-medical people. MSc in biochemistry is there, BSc in biochemistry is there. There is plant biochemistry, animal biochemistry, and all. But what you will be taught in your first year of MBBS is medical biochemistry. So whenever you are learning some concept, you will also be taught at the same time the relation of that topic with the management of disease. So that is the thing. So if you study biochemistry and medicine, pediatrics, all the clinical subjects, it will be very easy. So that's why it was very easy for me to excel in this field, because I studied medicine very well. So I was very easy. It was very easy for me to correlate the biochemical knowledge with the medicine. Yes, Pooja.
Okay, so yeah, so my next question is like, what is your message for the aspiring physicians?
Right. So guys, this is what I'm saying. The possibilities are innumerous. Okay, I think it's a dialogue from an anime. So I also watch a lot of anime. So in the personal life work balance, I forgot to mention. So I have enough time to watch so many anime. So one dialogue in the anime is that the possibilities of enormous. I think it is Hunter x Hunter. That in that anime, there's dialogue will come. So for anyone, the possibilities are opportunities, and they are enormous. So I will put my example. See, I came from a very middle class family. My father was bus driver. Okay, so I studied my LKG to plus 2 in Tamil medium. So when I joined my MBBS, it was very difficult for me initially. Everything is in English. Actually, it is not even English, right? It is all Greek and Latin. MBBS is actually in Greek and Latin. So you will find out all those words, Greek and Latin. It was difficult, but I managed to overcome that. So the student, and in my first year there is a book called Harper's Illustrated Biochemistry. I could not even read that book, I'll tell you. I don't want to hide or something. To be honest, I cannot read that book because the English was so difficult. I cannot read that book. But now, my name is in that book. So you see the difference, right? A kid who cannot read that book in his first year of MBBS managed to excel in that subject, and now that kid's name is in that book. So they have acknowledged my name in Harper's Illustrated Biochemistry 31st edition because of my suggestions and corrections. So I used to give them lot of suggestions and corrections. I managed to read that book during my MD third year. Okay, so that also I should say in the MD third year I read that book, so I managed to do that. So that's what I am saying. If you believe you can do, you will be doing perfectly fine. So it's all in your mentality. If you think that you cannot do, absolutely you cannot do. So many people, before even appearing in the exam, they accept the failure. It's like before even going to the war, you accept defeat. So guys, if you believe you can do, you can achieve anything. That is how this whole human race, see, we have succeeded in so many things. So this is all nothing. Okay, so you will be able to achieve things. So don't worry. So most of you may be thinking that I'm not studying in India, I'm studying in abroad. Never ever think that. So let me tell you very categorically and clearly, never feel inferior. So I have my friends, I should tell you, there was one cardiologist in the AIMS Delhi. He studied in foreign only. Okay, so don't think that the foreign graduates are inferior to Indian graduates. You should not put this in your mind. Okay, I have seen this in many students. Don't put that. No one is superior to anyone. Okay, everyone is equal. So you are all fine. Okay, you will be able to achieve your dream. You will be able to clear your next exam. So, and we will be with you. Okay, that is why the whole session is there for you, right? So we will be there with you. We will help in your progression. So this is my message is that today the thing is, believe in yourself. In one word, believe in yourself. That's it.
So, what do you think? Like, how are the concepts and basics of the particular subject? Can you, if you can, just give a gist of your subject to the students?
Yeah, so what you will be doing in your first year MBBS is, right, initially you will learn the chemistry of biomolecules, and most of these things you have already studied in your NCERT. Okay, so you will be studying the biomolecules like carbohydrate, protein, nucleotides, DNA, RNA. So all these things, it will be taught to you initially. Then the metabolism of that. So how the food we eat, how it is metabolized, how it produces energy. So all those things will be taught to you, and how it is related to diseases. Like there is something called inborn error of metabolism. Even diabetes mellitus, that is also a disorder of metabolism. So you will be taught the basic biochemistry. You will be learning all these basic things in your first year. So it is like metabolism, that is the major portion. Then molecular biology. Okay, so this will be your major things. So the books to read and all, so all these things I think we will tell in future.